Speaker. Mr. Speaker, one of the common is the issue of hospital bills. I know every senator, including yourself, you are normally in WhatsApp groups trying to fundraise for somebody who is sick, Mr. Speaker, even on compassionate grounds, even including funeral expenses, Mr. Speaker. But I think one of the biggest challenge to many Kenyans is the hospital bill. We hope the social health insurance, the SHA issue will be able to resolve, Mr. Speaker. And I hope with us contributing more towards the social health authority and the now transiting from NHIF to SHA, Mr. Speaker, will allow Kenyans to access medical care that they will not need to call for Harambees. Because every weekend, if it is not an Harambe for funeral expenses and medical expenses, it is for education. If it is not for education, Mr. Speaker, it is for building of places of worship, Mr. Speaker. So I hope and believe that the issue of hospital bill, if we are able to address the issue of fixing SHA and ensure that access to medical care is accessible to all Kenyans through universal health coverage, Mr. Speaker, we shall reduce by 80% contributions or Harambees that are done in support of hospital bills across the country. And you know the problem, Mr. Speaker, is not even the hospital bill. It is that we have commercialized medical services in this country. When you walk to a private facility, health center, they cannot explain to you as to why they are charging, for example, the amount they are charging in their medical bills. I saw in some instances a private medical facility was charging 20 million on medical bill. When you ask them the gloves, the syringes, they cannot quantify or who gives them. I think the issue we should regulate the private health facilities across the country. Because no one can tell us whenever they give you an hospital bill. And I know, for example, like Moi Teaching and Referral Hospital, Jaramogi Oginga Hospital, Coast General Provincial Hospital, Nakuru, the Rift Valley, they have a way of doing waivers to the needy, Mr. Speaker, that is being done by. But these private facilities, you saw Beauty and Buy, that led to the budge of the late, may her soul rest, Lucy, who was buried the other day, Mr. Speaker, that you are being told that that facility is licensed. The allegations we are hearing is licensed to provide massage and masseuse services, but you are told they were doing some surgery for beauty issues, and it shows that there is a problem within the system, Mr. Speaker, and I hope at the end of it all, we should be able to address such issues of having. Even one of the major issues is compassionate donations, Mr. Speaker. We have seen